大家好，我叫 John Harry， 来自巴基斯坦的学生。我今年25岁。我2013年来中国学习。我在湖南师范大学学医，我的专业是学医。我现在在湖南省人民医院学习和实习。我获得了湖南省奖学金和湖南师范大学外国留学生奖学金。我跟外国学生上了医学课，我讲的课是组织学、生理学、病理学和生物化学。我在中国跟小孩子们讲英语课。我上英语课的学生从3岁到16岁。我在湖南省人民医院和长沙中心医院跟护士们和医生们上英语课。好，谢谢大家。Good morning, dear viewers. I'm your host, John Harry. Dear viewers, today we're going to talk about the chest pain. As you know that in our last video we have explained one of the most important cause of the chest pain, that is heart problem. But in our today's video, we're going to talk about another one of the most important cause of the chest pain, that is tension pneumothorax. Now, what is pneumothorax? What causes pneumothorax? What are the signs and symptoms of the pneumothorax? That is clinical presentation. And how we can prevent ourselves from this problem, and how we can manage and treat this problem. To answer all these questions, we have invited Dr. Zhang in our studio. Dr. Zhang is a cardiothoracic surgeon, and he is an associate professor in Hunan Provincial People Hospital for the last 10 years. Good morning, Dr. Zhang.
Good morning, Harry.
How are you today?
Just fine.
Okay. Dr. Zhang, my first question is that, can you please very briefly define what is pneumothorax for our viewers?
As we all know that we have about 6 billion pulmonary alveoli in our lungs.
Okay.
6 billion. Which means we have a lot of balloons. We can see these alveoli as balloons in our lungs.
Okay.
So as to the balloons, during every inspiration and expirations, the balloon expanding and collapsing.
I see.
Okay, sometimes when the balloon want to collapsing, naturally the balloon want to collapsing naturally,
Okay.
but the body want to keep it not collapsing, keep it expanding. So the body keep a negative pressure outside the balloons, which the space is called pleural space, and this space is negative pressure.
Okay.
But for some kind of conditions, sometimes the negative pressure disappeared. So we call this condition pneumothorax.
So you mean around the lungs there is some kind of pleural space, right?
Yes.
That contains negative pressure.
Yeah, negative pressure inside.
Okay, and if this negative pressure is lost,
Yeah.
that causes pneumothorax.
Pneumothorax, definitely.
Okay. Now, what causes pneumothorax? I mean that what causes this loss of negative pressure?
As you have said, there's billions of balloon in our body.
Okay.
Sometimes we know some of the balloon is low quality,
Okay.
fragile,
Okay.
especially to the patient who have the chronic pulmonary COPD, obstructive pulmonary disease.
Okay.
As to the patient or have the bully,
Okay.
sometimes the balloon is fragile and sometimes it break.
Okay.
So this is the first reason, and this is the reason that the air leaked out from inside the lung.
Okay.
The second reason, or another reason for the cause of pneumothorax
Okay.
is for sometimes there's air leak from outside, for example, the chest wall.
Okay.
Sometimes we get the trauma,
Okay.
and for example, like acute knife get in chest walls.
Oh.
So the air can through the chest wall from the wound get
Oh.
into the pleural space.
Okay.
And also sometimes this is sometimes hemorrhage. So
Oh.
this is called pneumothorax.
Okay.
This is two main reasons for the
Oh.
pneumothorax happens.
So you mean that if someone get the injury in the chest, right?
Yeah.
And the air goes into the chest and it collapses the lungs, right?
Yes.
And person cannot breathe.
Yeah, that's
Okay.
one reason.
One reason.
The reason is somebody have the bully or
Okay.
COPD problems, so
Okay.
the balloon is fragile and break.
Okay. I
That's
see.
the first reason for the
Okay. Now let's suppose the patient get this problem, right?
yeah.
Now what's your treatment strategy once the patient get this problem?
As to the patient having pneumothorax,
Okay.
we treated a different patient with different treatment.
Okay.
For example, we first if the patient not have too much,
Okay.
for example less than 30% pneumothorax,
Okay.
we use fine needle air aspiration to
Okay.
let the air come out, and we also use very small tubes.
Okay.
For example, 1 millimeters or 2 millimeters.
Okay.
Yeah, chest tube, drain it into the pleural space to let the air come out. And also we use 2 centimeters or 2.5 centimeters visual assisted surgery to solve the problem, to cut off the bully or let the treatment on the pneumothorax.
Okay, so you mean that it depends upon the collapsing of the
Yeah.
lungs, right?
Yeah.
That how much lungs have been collapsed, right?
Yeah, definitely. How much percent?
Okay, how
that's
much
the
percent of the lungs?
lung collapsed.
Okay, I see. Now let's suppose the patient got this problem, right? And he reached to your hospital, let's say Hunan Provincial People Hospital. Now what's your what kind of facilities you provide to the patient in your hospital?
Yeah, we put the patient need first.
Okay.
So whatever the patient is newborn baby or senior patient,
Okay.
we treat this patient with different methods. We also discuss this program or therapy with the patient and the relatives.
Okay.
We treat different patients with different methods as I told about, from very
Okay.
less invasive
Okay.
patient, and this is what we try.
Uh-huh.
We saw also our hospital is the chest pain centers in this province.
I see.
So every chest pain center have every priority in every aspect.
Okay.
So if the patient have pneumothorax or chest pain,
Okay.
you can contact me on the hospital, on the private hospital, or also if you want WeChat like
Okay.
60749999.
Oh.
Okay.
Oh, that's
That's
great.
all.
That's great. Now let's suppose the patient got the injury and you have to treat the patient, right? Now how long the patient need to stay in your hospital?
I think from the inpatient, from the starting point,
Okay.
if the patient have pneumothorax,
Okay.
maybe he get in the morning or
Okay.
in the night. In that day, we can take the X-rays, chest rays for the patient or
Okay.
CT for him,
Okay.
and prepare for 1 day or 2 days,
Okay.
and do operation to surgery for him, and 3 days later,
Okay.
the patient can be discharged out.
Oh,
It
okay.
depends on how fast the patient can recover.
Okay, so
We have the rapid recovery program for this kind of patient.
So maybe minimum, let's say 3 to 5 days,
Yeah,
right?
yeah, definitely.
This is the time period.
Yeah, I think this is
Okay.
enough for the patient.
Okay. Thank you very much, Dr. Chang.
You're
Thank you.
welcome.
Dear viewers, as you have seen that Dr. Chang have explained the pneumothorax in a big detail. I hope you must have learned something out of it. Now it's your responsibility to take care of yourself and your loved ones. Now, if you have any question or any suggestion, you can email us. In our next video, we are going to see the real patient of the chest pain in our hospital, and we are going to see that what kind of nursing strategies are provided to the chest pain patient in our hospital. Till then, take good care of yourself and the people around you. Stay tuned. Have a good day. Bye-bye.
Okay, bye-bye.